Hello, my name is Keith, and this is a series of videos about healthy living. If you like these videos, please like and subscribe on this YouTube channel. This video was created back in December 3rd of 2021, and it's designed to share information about the different avenues to access health care, including Florida Kid Care, Medicaid, Medicare, and the federal marketplace, often referred to as Obamacare. The presenters are healthcare leaders in the state of Florida.
Hi, I'm Jody Ray. I am the director for Florida Covering Kids and Families at the University of South Florida in the College of Public Health. And our program entirely focuses on access to coverage and helping people navigate the healthcare system statewide. We're actually a statewide entity. And one of the programs that we manage is conducting outreach and enrollment for CHIP and Medicaid. And in Florida, primarily that comes under Florida Kid Care, which covers kids in Florida till they turn 19. And so that program doesn't include the Medicaid for adults. There are certain categories of adults. Mostly we assist parents with young children and pregnant moms primarily when it comes to enrollment in the Medicaid program. So Florida Kid Care is, again, like it's our CHIP and Medicaid program combined, our children's health insurance program. Every state has one. I think, I don't want to patronize this audience. I think they probably, know a lot about the Florida Kid Care program. It's administered by Florida Healthy Kids on the CHIP side, and Department of Children and Families oversees eligibility for Medicaid, and the Agency for Healthcare Administration manages benefits for the Medicaid program as well as Medikid. So the Florida Kid Care program has 4 parts because we have the most complicated program in the country. The first program obviously is Medicaid, Medicaid for children, and that covers kids up to 138% of the federal poverty level. So it's across the board, kids up to 138%. The Medikids program is it's a Medicaid lookalike program. But it's CHIP dollar funded, meaning that it's not an entitlement program. It's part of the Title 21 program, but it is the benefits are administered by ACA as well, the same way they administer the Medicaid benefits, because they're all the same benefits. And that covers kids 1 to 4 who do not qualify for Medicaid because their family's income is too high. The second program is Florida Healthy Kids, which covers the 5 to 18-year-olds or till they turn 19. And those kids, again, are those that are not eligible for Medicaid because the household income is too high. And then we have the Children's Medical Services. I always get this wrong because they've changed the name several times, but primarily, obviously, that's for the kids that have chronic health care, behavior health, mental health care issues that requires they access care more frequently than maybe what is considered average. It also provides a coordination of care, which is really great for those families who have to interact with the healthcare system in many different ways. And having that coordinated level of care is really important to those families. And those, again, those before used to be only CHIP kids, but now it is both CHIP and under Medicaid. They can be in CMS. And so those are the components of the Florida Kid Care program in the state. It's a health insurance designed with children's healthcare needs in mind. And that's why it's a real advantage to have a program like this, because typical health insurance is not designed for children's health needs. Particularly when you look at things like maybe supportive therapies and things like that, they're based on adult healthcare needs in predominantly most health insurance. But that's why Florida Kid Care is particularly important for families in Florida, and especially families whose kids really need to interact with the healthcare system more frequently. Um, and in Florida, the program covers kids not only in Medicaid up to 138%, but the CHIP kids go up to 200% of the federal poverty level. Off the top of my head, I don't know what that number is, but and those kids usually pay $15 or $20 for all the kids in the family. So up to, I think it's 185%. They pay, I could be wrong. It could be 150%. The families will pay $15 no matter how many kids they have in the household. So they can have 5 kids, they pay $15 a month for premiums, and then they have, all the benefits of CHIP. And then above that, up to 200%, it's $20 per family per month. Once they've exceeded that 200%, families can enroll their kids in the full pay program. I know Medikids just increased its premiums by a lot, actually. I think they went up by 11%.
Sorry to interrupt, but Jody, the 200% for a family of 4 is 53,000.
Thanks. Yeah, so the Medikids program premium just went up, and that will start this month for I believe for the January 1. So families will be paying the higher rate starting this month for the Medikids coverage. And Healthy Kids also has full pay as well. So Medikids and Healthy Kids both have a full pay option. Again, and it's expensive. It's over $200 per child per month. So it's pricey. And when you're looking at coverage itself, Florida Kid Care is, in most cases, a better option for kids when you're specifically only talking about healthcare. But when we're talking about cost, a lot of those families really can get marketplace coverage for their kids for a lot less. And so it can be unaffordable to be in the Kid Care program at full pay for many families, especially those families that are not that far over the cutoff of the 200%. So that can be a real challenge for families. So we really try to tell them what their options are in both cases. And so we help a lot of those families apply for coverage in the marketplace as well, so we can get those kids covered. And a lot of times we can get those kids covered for next to nothing if their income, particularly if their income is under 250% of the federal poverty level. So that just provides another option for them. If they're under 200%, the marketplace will require them to go to CHIP or Medicaid, whichever they're eligible for. If they do choose to remain, those families remain with those kids in the marketplace, they won't qualify for tax credits, unfortunately. So those are some of the ways that it's important to know how these programs work together. Right now, we're seeing a lot of growth in Medicaid because Medicaid really isn't doing, renewals. And so, I think one of the things that we're going to see very soon is once DCF gets the green light to start rolling out renewals. And once they start rolling out renewals, that means disenrollments will follow with that, because we have people in Medicaid that they're not actually kids that aren't qualified for Medicaid, but because of the pandemic, pretty much most anybody who applied for Medicaid were getting Medicaid. CMS did tell me that the state is required to give them 60 days notice with their plan for disenrollment. And they did tell us they would let us know when that is. I think everybody who's in this space of doing any kind of enrollment or even health coverage education, health literacy education, should be prepared for what that's going to look like, because I think a lot of families are going to need help. A lot of families are going to fall through the gap. Ideally, when they go through renewal, they'll be sent to the right program. electronically, they're supposed to automatically transfer to CHIP or the marketplace, depending on their likely eligibility. But we know that doesn't always occur in the way that it ought to occur, and families get lost in the shuffle. And so I would encourage folks to just be, stay tuned and be aware when this is happening. And my understanding is that they're going to roll it out in phases. Like they're not going to just all of a sudden in one lump sum do all this massive renewal, and we're going to suddenly have 300,000 people dropped off of coverage. That's the ideal. That doesn't happen, but I think it's good for folks to be aware that this could happen, and a lot of those folks could need help to apply for not just Florida Kid Care, but also for the marketplace. So this is where we are right now. Florida Kid Care enrollment, I know it's kind of low, and it's had a steady disenrollment. I think some of this is part of that, in terms of the COVID pandemic's impact on the policies that all of the programs are using right now. So I think that's just important to get sort of on everybody's radar. Keith, remind me what your questions were so I can.
Well, you answered the primary ones. I guess the one question I have is if someone needs assistance with signing up for Kid Care.
Well, I mean, first, ideally, you would call Keith, and he would connect you with assisters. If you're in Brevard, across the state, my team.
That's a new one, isn't it?
We have here. I got it.
Okay.
Go ahead.
So sorry. So my team does assist anyone in the state of Florida. So we have the Kid Care sister team, as well as I know we have navigators. Some of the navigator teams across the state do enrollment for Florida Kid Care. I know that's not their primary role, but it is. They do have the ability to do that, and they've been trained to do that. The one thing I would say that's a challenge right now is Florida Healthy Kids decide to put their basic trainings as online trainings, which we've been managing. Unfortunately, we've filled all the seats that they have budgeted for this year. And I don't exactly know yet what they're going to do going forward. But so if anyone is needing Kid Care training, well, first of all, Keith and his team, I know he's got people that have already been through the training, so they can provide that training to your local folks. And Keith, if you're needing more resources, please let me know, because we have plenty of resources. Or if you need somebody to do a virtual presentation for a group of people, we can't do the one-on-one trainings with anybody because I don't have resources to support that level of training. So, but if you wanted to do a big training like this with a group, certainly somebody from my team would be willing to assist, at least, with some of the basic components of the Kid Care program.
And I could provide that locally. That's not a problem.
Mm-hmm. Yeah. And so, applying for Kid Care, right now, the only way to apply for Kid Care is through the Medicaid application, because the Kid Care app has been offline for a year, and no update on when that's coming back. We have no idea. And so that's been a frustration for, I think, a lot of families. It's confusing. They don't necessarily know where they're supposed to go. I think, intuitively, people don't just know they need to go. I know the website sends them to the Medicaid site. And that's the best we can work with right now. So if you're assisting families, I would say use the Medicaid application. And as long as they don't need anything else, do a Medicaid only app. So if you're going onto the Access app and you have the option applying for Medicaid and other benefits like food stamps and cash assistance. But if they only need coverage, select Medicaid only. It's a very easy app to do. It is actually, it got to the point where the Medicaid only app was actually easier to do than the KidCare app. So I would continue to encourage people to utilize the Medicaid app to ensure that people are getting coverage. The kids are getting coverage. I think that's about it.
Yeah, Jody, that's a great lead in to the Medicaid team. So, so thank you, Jody. Appreciate that. And I'll move on to Sheila and Reginald. So tell us about Medicaid, access to Medicaid, how we can get there, and who's eligible.
Well, good morning. I'm Sheila Kelly, and I'm with Department of Children and Families. And I'm what you call, well, I work for the program office here in the Central Region, and I'm what you call a policy specialist. When we assist operations with a lot of technical questions, dealing with all of our programs, really. And Reggie is also a part of that team. And I specialize in family track. He's a specialist in the adult track that deals with the nursing homes and those type of more complicated programs. Reggie, do you want to say good morning?
Good morning, everyone.
And so, Keith, what I did was just put together a really short slideshow that tried to encapsulate the questions, the 3 questions that you highlighted, so that I wouldn't ramble. And so I'll just go over that, and I won't read it verbatim, but basically,
Yeah,
the basic.
I'm finding out where I put it. So hold on.
Okay, I'll give you a minute to look at that. And Reggie, I also emailed that to you. And like I said, it's very short. It's only 8 slides.
That's not short.
I think it's short.
Okay, I'm going to share it if I can
It's
find
not
it.
fancy.
Do you see it?
Not yet.
No. Okay. Sorry about that.
It's okay.
Where is it?
There you go.
All right, good. All right, just tell me when to move and I will. So
Okay, and so basically we can start right here, and it's just giving highlight of what the Medicaid program is about here in the state of Florida, what it provides, and we all mostly know that it provides medical coverage to our low income individuals and families. And to be eligible for what I call the family related Medicaid, individuals have to meet certain technical criteria and certain income tests for a coverage group. And by that, we just mean a household size, for example, whether it's a mom and her child, or whether it's an intact family, including a mom, or the child and a father, underemployed family. And then Medicaid eligibility in Florida is determined by either our office, DCF, or SSA office for those who are recipients of SSI. You can go to the next slide. And just a general overview of, well, who are these people in this coverage group? It can range anywhere from parents and even caretakers, caretaker relatives of children. Caretaker relatives, say, for example, you have aunties, uncles, grandmothers within a specific degree that want to a specific degree of relationship, biological relationship to a child. They can apply. Sometimes they will apply just for the child themselves, and sometimes they may want their needs included as well. We can look at that. We can assist with Medicaid for children from birth up to 21 years old, for pregnant women. And even a sidebar to that is even Medicaid for the, well, it gets created in the unborn stages. So, and that particular situation, there's unborn coverage created when a pregnant woman is approved for full Medicaid. So therefore, it's an easy transition to get the baby added onto Medicaid with the demographics and everything once the woman has the baby. So there's no delay there. They already have their Medicaid ID number so that they can begin receiving services as well. And then there's also coverage for what we call former foster care individuals, age up to 18 through 26. I believe that was a part of what we call the Medicaid expansion a few years back. And then there's another group, non-citizens with medical emergencies. We abbreviate that with EMA services, emergency Medicaid for aliens is what that stands for. And then also Reggie's forte, aged and disabled individuals not currently receiving SSI. So he's really helpful with our team on that. And the Medicaid cards, those are permanent, they're gold cards, we call them gold cards, and they are issued to our customers who are eligible for Medicaid. So once that caseworker out there in operations gets that customer approved in the mail, they should receive a Medicaid gold card. And that's basically what they want to use as to present to any office that they go to receive for services, Florida Medicaid providers, doctor's offices or what have you. That's what they will present to receive services. Then there's another category. Let's say someone is over the income limit for full, what we call full Medicaid. Well, then they're enrolled in a share of cost. And even when this pertains to children, let's just say that if they are enrolled in share of cost, they're automatically also sent up the application to Florida Kid Care. I may have said that backwards, but yeah, they're automatically, that application is already automatically forwarded as that child is enrolled in our system. If they happen to fall into a share of cost, they're again, because they're not passing the income test to qualify for the full Medicaid. And so just a real short summary of how that works. For adults that are, let's say, enrolled in that share of cost, they have, it's like a deductible type insurance, and their medical bills have to amount to a certain amount before the bills will begin to be paid. And say, for example, if the share of cost is $600. So once they reach that threshold and exceed it, then they can start submitting those bills in order to see if DCF can help get some of those bills paid. Okay, you can go to the next slide. Applying is very easy these days. Thank God for modernization. Customers with internet can go to their home computer. They should be able to go to one of our partner sites. They may be able to go to one of our storefronts, access that computer, and just get on myflorida.com, access Florida, and apply for benefits. And even in the storefronts, there are staff there that also help them navigate the application or any technological issues they may be having with the system. And they can access what we call the self-service portal 24/7 to kind of get an update on the status of their benefits. Next slide.
And our healthcare navigators, our health insurance navigators can also help with people signing up for Medicaid.
Yes. And so really this slide is just repeating what I just said about the accessibility of 24 hours a day. There's even also on the internet, the DCF virtual assistants. Sort of like when we go onto the internet, checking our different accounts or whatever, you get this quick pop-up. I'm Kelly, a virtual assistant here to help you with questions a day. You can either utilize that, or you could just, continue to navigate on your own. So that's even there as well as the automated response system located below the 850 number. Next slide. And those are the various ways that our customers can apply for benefits. Again, through the internet, they can go to the partners.
And I can send these slides out later because they have links on them.
Okay, awesome. All right, and the last slide. And so after all the work is putting in the application, how people want to know how long it takes. Well, to complete the application, it's very short, about 30 minutes, but processing may take a little longer. That may take the operational team out there, maybe up to 30 days. It doesn't always say it's gonna take 30 days, but at least up to 30 days to process the application. And I'll let Reggie chime in to share more information about the adult track side of the Medicaid.
Yes, Sheila. The biggest difference with adult Medicaid is, of course, a lot of these programs are set up to where it helps families with children So mainly the programs we deal with is for basically single adults or married adults. So with our programs, we have 3 technical factors that we would look at: age, blind, and disability. Now, the age requirement is age 65. So if a person's age 65, they're potentially eligible for Medicaid as an adult. Of course, you got blindness. Some people can be blind, but not legally blind. So we kind of look at what Social Security will deem them as being blind or disabled as being blind. So we'll look at that. And then the third factor is the disability that most adults have to meet, which is really determined by Social Security standards that we use as far as disability. So most of our clients have to meet that disability standard, and without having children, that is usually the biggest factor that has to be granted. So our programs are a little bit different. It's not automatic by having a child. So once you don't have a child, a minor child, then you have to meet one of those factors to get Medicaid. And most of our clients usually have to meet the disability factor. That not a guarantee. Basically, you have to be out of work for 12 months or more. That's kind of the minimum thing that Security looks at. We also have clients who apply for benefits in the nursing, which you still have to be disabled, blind or disabled.
That already was.
Excuse me?
I muted him.
Yes. Like I said, we also have programs where people apply for Medicaid in the nursing home, Medicaid in ALFs, Medicaid at home, hospice Medicaid, which is for people who have 6 months or less. So our programs is a little bit more unique because we mainly deal with adults that do not have minor children. And personally, I think it's kind of a little bit more difficult to qualify because if you don't have a child, you have to meet those 3 requirements. Of course, age, you only want to be 65 at some point. Blindness is something that's very unique. So that third factor of disability kind of runs most of our clients, and it's very difficult to get disability. They look at mental disability and physical disability. So a lot of these rules are set by the Social Security Administration, depending on who qualifies. And that usually is the most difficult hurdle that most of our clients have to meet. And that sets us apart from, of course, the family track and kid care and all those other programs where we don't have any other type of Medicaid. If you're not 65, blind, or disabled, we don't have any other type of Medicaid alternative. We would have to recommend someone calling our 211 hotline or outsource resource clinics and things like that. So adult males are a little bit difficult, a little bit more involved, but that's just the way the rules are set up. And most of our clients just have to be disabled and meet the qualifications for Social Security set. And they usually ask the question, are you gonna or be expected to be out of work for 12 months or more? I broke my ankle and I'm going to be out for 6 weeks. That's not a disability, but we know we still need the help. So our programs are very unique and a little bit more challenging to get Medicaid as an adult without any minor children. So, and we see a lot of that. So we have to have a lot of resources and kind of outsource them to other community programs to help them in the meantime, because a lot of people just fall between the cracks. They're not disabled to the point of permanent disabled, but they need help now. So we have to, call the 211 hotline or United Way or get in contact with some of your local clinics that could possibly be able to help them in the meantime. But some people just are not going to be disabled and they just have to find alternative measures to try to get Medicaid. So that's pretty much our programs in a nutshell.
Well, thank you, Reginald. And I like how this is flowing because it's kind of flowing from one programmed almost automatically into the next. So so we have Joel Hernandez on the call, and he's going to share with us about Medicare and access to Medicare, and you know, what are the requirements related to it, and how can we get help?
Hey, good morning, everybody. First of all, let me make sure that you guys can hear me okay.
Yep.
All right, perfect. My name is Joel Hernandez. I'm a public affairs specialist for the Social Security. I work out of the Orlando office and manage the outreach and educational efforts for the agency in North Florida area. It is a privilege to be a part of this event and to be sharing with the other panelists, especially when we're talking about Medicaid. It is a lot of questions that we get for Medicaid at the office, and it was a good refresher to listen to Sheila and Reginald. I am grateful for this invitation, but before I go into Medicare, there was two things that was mentioned, and I want to add a little bit more information about that. When we're talking about blind, being considered blind by the Social Security, we consider you to be blind if your vision can't be corrected to be better than 20/200 in your better eye, or if your visual field is 20 degrees or less. However, if you're not found to be blind, you have a vision condition, you can get disability in other ways. It doesn't have to be a blindness. Another thing that you mentioned, when you have 6 months or less, our disability process, when you file for disability, it takes about 3 to 6 months for a decision to come in. But when you have a terminal condition, there's a list of compassionate conditions that we have on our website. If you need any of those disabilities, your disability process will be less than 10 to 12 business days, right? So just adding that information to help you out in case anybody had questions about that. Before I go into Medicare, I want to add a reminder. Social Security and Medicare are two separate agencies. Our website at ssa.gov provides a wealth of information about our benefits and also about Medicare. However, Medicare's website, medicare.gov, provides more detailed information about Medicare and its coverage. What Social Security does, it enrolls you in Original Medicare, Part A and Part B. So as we know, Medicare is our country's federal health insurance program. It is for people age 65 or older, people younger than 65 with certain disabilities. Permanent kidney failure, ALS, or Lou Gehrig's disease can also qualify you for Medicare. This program, it helps you with the cost of healthcare, but it doesn't cover all medical expenses. So let's talk about who can get Medicare. Medicare Part A is for people who are over the age of 65, who are citizens or permanent residents of the United States, are eligible to Medicare Part A. You're eligible to Medicare Part A at no cost if you have worked long enough to become insured for the program. As you know, we have the two different taxes. One is the Social Security tax. It shows on your pay stubs as the OASDI, Old Age Survivors Disability. That is a Social Security tax. It helps cover the Social Security program. Now, there's also a Medicare tax that shows on your pay stubs. That Medicare tax helps you pay for Part A. So if you work long enough, you're going to be eligible to Medicare Part A at no additional cost to you based on your age or your disability. Now, it doesn't mean that because you have not worked long enough, you're not going to be eligible to Medicare Part A. The only thing that it means is that Medicare Part A is not going to be free. So if you have not worked long enough and you reach the age of 65, you can apply for Medicare Part A, but there's going to be a monthly premium. Now, when should you file for Medicare? You should file for Medicare 3 months before your 65th birthday. If you are approved for Social Security benefits you're going to become eligible to Medicare 24 months from the month you were entitled to receive benefits. So at that time, you're also going to file for Medicare. Now, there's a difference when you have conditions like ALS. ALS allows you to get Medicare right away if you're found to be disabled. Same thing goes with when you have kidney failure or end-stage renal disease and you're receiving dialysis or you get a kidney transplant, you're also going to be eligible for Medicare, and you should file at that time showing proof that you're receiving dialysis. Now, Medicare Part A.
This morning, if they haven't done it.
Sorry about that,
sorry,
Joel. I
yeah.
took care of it. So
Okay, it sounded like they were asking like a question, but I'm probably not.
no, I think it was a interruption.
Medicare Part. That's fine. That's fine. Medicare Part A is a hospital insurance. It helps you pay for inpatient care in a hospital or limited time at a skilled nursing facility. Medicare Part B is your medical insurance. It helps you pay for services from doctors, other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventive services. The other parts of Medicare, meaning the Medicare Advantage, the Part D, the prescription drug coverage, the Medigap, the supplemental insurance, those are run by private insurance companies. So the Medigap or supplemental policy, it helps you pay Medicare out-of-pocket costs. For example, co-payments, co-insurance, deductible expenses. The Medicare Advantage plan, which was known as Medicare Part C, it includes all benefits and services covered under Part A and Part B. Prescription drugs and vision, hearing, and dental, they're all bundled together into one plan. That is the Medicare Advantage plan. Medicare Part D, it helps cover the cost of your prescription drugs. Now, the enrollment periods for Medicare. The initial enrollment period, there's 3 enrollment periods. The initial enrollment periods, this is a total of 7-month period. It begins 3 months before your 65th birthday, includes the month you turn 65, and then 3 months after that. This initial enrollment period also applies to when you are entitled to disability benefits. When you reach that 24th month of receiving disability benefits, is very similar to when you turn 65, 3 months before, 3 months after. The other enrollment period is the special enrollment period. Now, a lot of people ask, do I have to file for Medicare if I'm 65 and I already have a group health insurance? One very important thing is when you become eligible and you do not file for Medicare benefits and you do at a later period, there's going to be a late enrollment penalty. But that late enrollment penalty is waived when you are working for an employer, actively working for an employer and receiving a health or a group health insurance. When you are in that situation, we can open a special enrollment period for you. The only thing you need to do is you need to file for Medicare Part B and provide proof that you have that group health coverage. Now, that proof, you can submit it to us. You can submit it to us online. There's a section, apply for Medicare Part B online during this enrollment period. That's where you're gonna upload your applications and documents to show proof of coverage. You can also mail. There's 2 forms that you need to handle when we're dealing with the special enrollment period. The CMS 40B form is your application for enrollment in Medicare Part B, and the CMS L564 is the request for employment information. Those 2 forms you're going to submit. And I'm just adding all this information just in case there's someone in the audience that is in a similar situation. Most important thing is when you submit a special enrollment period or you submit paperwork, on the 40B remark section, just make sure that you put a little statement. I want Part B coverage to begin on such and such month, okay? Now the last enrollment period is the general enrollment period. if you didn't sign up for Part A or Part B when you were first eligible, or during a special enrollment period, you can still sign up during the general enrollment period. This happens between January 1st and March 31st of each year, and the coverage does not begin until July 1st. Now, like I told you, if you're not working for an employer at the age of 65, if you just miss your enrollment period, there could be a late enrollment penalty for as long as you have Medicare Part B. Medicare Part A, filing for it online. Let's say you are working and you want to file for Medicare Part A and continue to work. You go to our website, ssa.gov. You're going to look at the section to apply for benefits. You're going to begin your online application. There's going to be a section that is going to have you choose to sign up for Medicare only and delay filing for retirement benefits. You can file online for this type of benefits, or you can call for an appointment. I want to add that if you are receiving benefits before the age of 65, let's say you're enrolled at 62 for Social Security retirement benefits. When 65 comes around, your enrollment to Medicare Part B will be automatically. The same thing with disability. If you're receiving disability benefits at the 24 months period, your Medicare Part B enrollment will be automatically. Unless you are living in Puerto Rico. If you're living in Puerto Rico, it's not going to be automatic. You need to call and file for Part B coverage. Now, if you enroll for Medicare Part B during the first 3 months of your initial enrollment period, your coverage begins that month that you turn 65. If you enroll the month that you reach 65, the coverage begins 1 month after. During the last 3 months of the enrollment period, if you enroll during that first month, your coverage will begin 2 months after. If you enroll during the second and third months, your coverage will begin 3 months after the month of enrollment.
So Joel, I got one
Sheila and
question.
Regina, yeah,
I'm going to interrupt you, just one question. So
that's fine.
if someone wants to receive Medicare when they're 65, but wants to continue working, they can do that?
Yeah, they can do that. That doesn't affect them in any way. The only thing is that they're going to have to do an application. They can do it online, and they would have to select that option saying that you only want Medicare Part A and you want to delay your monthly benefits, or you can call us and set up an appointment. And during the application process, we're going to ask, do you want to receive retirement benefits? You'll say no, and you're only going to get Part A.
Yep, I just did that. So I just want to make sure that people were aware of that. So
yeah, and if you remember during the application, they also ask you, do you have a group health coverage? Because we document that. That way you get a letter telling you what the process will be for the special enrollment period.
Right.
Okay. Now I wanted to add something when Sheila and Reginald were talking about Medicaid and the limited resource and income limits there's something that is called extra help. Extra help helps you paying the monthly premiums, annual deductibles, premium co-payments related to the Medicare prescription drug plan. Now, you may qualify for that extra help if you have limited income and limited resources. This is tied to the federal poverty level. The income and resource limits, they usually change each year, and you can check for the current numbers at ssa.gov extra help. Now, if you already have Medicaid, full Medicaid coverage, you're going to be automatically qualified to the extra help. Okay. Now, another very important thing is, and Sheila, you can clarify that if I didn't explain it correctly. but that's another option that you have when you get enrolled into all these coverages of Medicare. Extra help is something that is there to help our population that has limited income and limited resources. Now, my Social Security, I want to add this, it is very important. It is a good place to get information about Social Security concerning yourself. You will go to ssa.gov and open a My Social Security account. Within that account, if you're receiving benefits, you can change your address, you can change your direct deposit information, you can obtain benefit letters, you can apply for a Social Security card. There's a lot of things that you can do that you don't have to call the office, that you don't have to go to the office and wait 1 hour, 2 hours, however long you're gonna have to be on that waiting list. If you just go online and enroll, there's a lot of things that you can do bypassing all that waiting period. One very important thing that you can do online, and this is for the people who already have Medicare. Medicare card is your proof of Medicare insurance. If you lose that card, you can apply for a replacement card online, and you will get a replacement card within 30 days to the address that we have on file. Now let's talk about the premiums for Medicare. As we said, if you're fully insured, Medicare Part A will be at no cost to you. Medicare Part B, currently this year, the premiums are $148.50 per month. Next year, you're gonna be looking at $170.10. That's gonna be the cost for Medicare Part B. And you can look at the Medicare.gov website for additional changes to coverage and the Medicare cost. Now, a little bit of good news before I finish. You guys probably know this. For people who are receiving Social Security benefits or SSI benefits, there's going to be a 5.9% cost of living increase added to your benefit. And finally, you can search us on our website. You can get all the same information that I gave you today. You can also follow us on social media, Twitter, Facebook, Instagram. We constantly submit new videos and new blogs, new pieces of information so that you can remain informed at all times. There's a section within our website. A lot of people have questions about how the Social Security is conducting business during the pandemic, when the offices are going to remain open, how can I get a face-to-face interview during the pandemic. There's a section on top of our website. It's called the COVID-19 update. If you go in there, there's a lot of information related to the COVID-19, the pandemic, and how we're conducting business during the pandemic. So, do you guys have any questions or Keith? I'm done right now.
Very much appreciated. And we only have a few minutes left. I want to share some slides regarding the marketplace. I'm not going to take a whole lot of time. I'm just going to hit the high points. So let me see if I can get that done real quick. Can you see the slide that says health insurance marketplace?
Yep.
All right, good. All right.
Yes, I see it.
I'll be real quick. I hope. Here we go. First slide, just if I can get this to work right. First slide is just to let you know that the enrollment period has been extended to January the 15th for the federal marketplace. The Affordable Care Act actually was enacted in 2010, fully operational by January 1st, 2014, and our United Way here in Brevard was part of that consortium of navigator organizations from the very start. We were operational through 2017 or up to 2017, and now we're back in the game again, helping people with signing up for healthcare. The Affordable Care Act provided subsidies for consumers or premium tax credits. Florida has not expanded the Medicaid program. We're one of the few states that has not done that yet, which kind of makes it difficult for people who are below 138% of federal poverty level. And then also the Affordable Care Act provides cost sharing reductions between 100% and 250% of the federal poverty level. Those are the individuals who receive the most benefits from the federal marketplace. American Rescue Plan Act actually provided more funding into the marketplace to help with subsidies, to help people provide, to qualify for help on the marketplace, may be able to qualify for more tax credits and where, I know in Brevard County, we have some plans that actually enable people to get their insurance with zero premiums and zero deductibles in some cases. We're part of a larger consortium. Jody Ray is on this call, and she's the one that leads us. Florida Covering Kids and Families is that consortium network. They're located in Tampa and United Way of Brevard, the only United Way part of this network. We cover Brevard County, and this consortium covers the entire state of Florida. How it works, apply through healthcare.gov. And also through that application, you can also apply for Medicaid and Children's Health Insurance Program. Our navigators can also go directly to those locations, those sites, to help with signing up for those programs. Children's Health Insurance Program in Florida is the Florida Kid Care we were talking about. You can apply online, you can apply by phone, by mail, or in person. And once your eligibility is determined, most people can enroll immediately. Whoops. Our navigators deliver free outreach and enrollment services. They can assist with telephone, in-person, virtual enrollment. We can provide education and outreach activities for your organization. They're trained, certified, and licensed to provide these services. And again, they are free to consumers. We don't charge. Open enrollment. I put this slide in here just as a reminder that the plans under the marketplace cover all your basic minimum essential coverage, including doctor visits, hospital stays, prescriptions. And just a note on the preventive care, make sure when it is preventive care, the doctor codes it as such so they don't bill you for that. And then also all plans cover pre-existing conditions. Just another note on that also, through the Affordable Care Act, families can have children stay on their plan up to age 26. Year-round services, I shared with you what the open enrollment period is, but we have a special enrollment period as well, and that goes that's basically means the rest of the year, and people can sign up during the rest of the year for coverage if they have a change in circumstance, like a lost or reduced income, change in residence, or maybe an added dependent or a lost dependent in the household. To get coverage local here in Brevard County, just call the number on the screen, 321-615-3764, to allow us to schedule your consumers with one of our navigators to get assistance. Navigators, what they do, they're trained to help consumers and also self-employed individuals as they look for health coverage with completing eligibility and also enrollment. Those individuals are required to be unbiased. They can help with all the questions related to insurance, but they can't choose a plan for you. And their services are free to consumers. Our United Way Brevard navigators are listed: Alina, Millie, Carlene, Morgan, and myself. Just let you know, four of those, and I'm the exceptional one here. Four of those are bilingual. I'm the one that's not bilingual, so maybe I need to start learning some Spanish. So call us at that number that I said earlier to help you out. Open enrollment already started back in November 1st. Deadline for coverage for starting January 1st is coming up soon on December 15th. We have a nav lab on a Saturday right before that to try to help those people get in at that time. We also have a nav lab on January 15th, which is the last day to sign up for coverage for the open enrollment period, and that coverage would start February 1st. And there's also, like I said, the special enrollment period after that. Will you save money? If you go on to healthcare.gov, there is a little, and if I had time, I'd click on it, but there's a link on healthcare.gov where you can actually see if you can save money without actually enrolling. And a lot of people will use that to see, what it looks like for them. And you can certainly do that as well. What else can navigators do? They can help with assisting with Medicaid and Florida Kid Care. And we're also going to be setting up training to, basically answer some basic questions about Medicare, because we do get a lot of Medicare individuals coming to our sites as well. Our navigator locations are throughout Brevard County at libraries and career source Brevard locations. I will tell you, though, that we are now finally starting to get back into the hospitals. We are getting into Parish Hospital right away, and hopefully we'll get back into the other hospitals. They've been less, until recently, we've not been able to get much movement into the hospital still, and understandably, because of COVID, but that's hopefully going to open up for us unless we have to deal with this new variant. So how can you get started? Call 321-615-3764 to help us set up that appointment. Just another note that our locations are ADA compliant, so that we're able to provide access and privacy for our consumers. And then I just use a pop quiz at the end to make sure everybody heard what I said, but I'm not going to do that here. And that brings us to 9:32. So we are just a bit over an hour. I'm going to stop sharing and ask those who are still on the call if there are any other questions. I do appreciate you being on this call. And I do know that those of you who are on this call represent other people. So that's much appreciated as well. I will, since I'm recording this, I will also post this recording and send out the earlier slides as well. Any questions? Last minute comments? Jody, I know I talk fast. Did I do a good job explaining Marketplace? You're muted, but hopefully.
I give you an A+.
All right.
Well done.
All right, thank you. All right, if there are no questions, and if you do have questions, please unmute yourselves or use the chat. But thank you for doing this. This is kind of kicking off a year's worth of panels that we're planning on doing on the first Friday of each month. And the next one we'll be discussing mental health services here in Brevard County. So we'll see you then. Thank you all for joining us.
Thank you. Goodbye.
Yeah.
Thank you. Goodbye.
Bye-bye, Shannon. Bye-bye, Joe.